Lyme disease and pregnancy need to be discussed. This is part of a Common Sense Lyme series. I'm Dr. Daniel Cameron. I'm an internist, an epidemiologist. I'm not an OBGYN doctor. I don't take care of young children, but nevertheless, I have these discussions with prospective moms and dads. I'd like to touch on this subject and share a few of my thoughts. So, thank you for joining me. Now, in my experience, Lyme disease in pregnancy requires proactive planning. There's no formal guidelines. The CDC acknowledges that untreated Lyme disease in rare cases lead to complications. Early treatment and careful planning often leads to excellent outcomes in my practice. Now let's talk about goals. You should start the conversation early so you can plan safely. If you may become pregnant in the next year, bring it up to the doctor. Timing matters. So if you have Lyme disease, if you have the possibility of co-infection, if you have an unexplained illness, it's reasonable to talk to the doctor and plan ahead of time. I like to complete treatment before conception. It's important to stabilize the health to protect you and your baby. Pregnancy can change the immune system. In fact, sometimes when you're pregnancy, the symptoms drop only to return postpartum. I like to complete treatment before pregnancy. It appears to lower the relapse rate. I advise use of temporary contraception to avoid having to be treated with doxycycline or perhaps a tovaclone before they become pregnant. Some antibiotics are not safe or at least unknown in pregnancy. Delay may make a difference if you can get someone well before the pregnancy starts. I switched my patients to more pregnancy safe protocols. I transitioned from doxycycline to avoid having problems with doxycycline entering the teeth and the bones. Also, atovaquone used for babesia is unknown for use during pregnancy. If I can, I use safer alternatives like amoxicillin or cefuroxime. And if needed, I might switch to Zithromax depending on what the OBGYN has to say. Now, I like to screen before the pregnancy for co-infections like Babesia, Bartonella that may complicate pregnancy if untreated. If someone has persistent symptoms despite standard treatment, it may involve a unresolved co-infection. Also, Babesia in particular has use of drugs like atovaquone that aren't yet proven safe in pregnancy. Now, this is a patient who's a 32-year-old woman in my practice who had Lyme and Babesia who wanted to start a family. She was fatigued on a 12 clone. We were tapering it. We posted pregnancy until we could complete the Babesia treatment. 10 months later, she had a healthy baby by preparing early. Now, common questions I run into is can I get pregnant while being treated? Yes, but it's safer to stabilize and shift to safe meds first. Can Lyme disease be passed to the baby? Early treatment reduces the risk, according to the CDC, and that's been my experience. Is that I have a countless number of women who've had Lyme in the past who go on and get pregnant and have healthy babies, but there's always questions and uncertainty for every mother. I always involve the mother and the father in a discussion prior to the pregnancy, just to discuss questions and uncertainty. And what if I get pregnant during treatment? You should contact your doctor. Many go on to have healthy pregnancies. There's much we do not know about Lyme disease in pregnancy. Here are a few unresolved questions that come up frequently in my practice, like how often does Lyme disease cause pregnancy complications if untreated? I have patients who've been quite sick. Their Lyme disease or co-infection have not resolved. They've gone through the pregnancy. They come up with a successful pregnancy, but that doesn't mean they're nervous. The actual number of complications is unclear. When is it safe to stop antibiotics before conception? Again, there's no clear answer. I try to at least wait 2 to 3 months before conception to allow time to monitor for a relapse. What's the safest Babesia or Bartonella treatment during your pregnancy? There are drugs that are used for Babesia and Bartonella that are not safe or at least unknown during the pregnancy. We really don't have the protocols for these co-infections The same protocol for Lyme disease, like amoxicillin, does not work for these infections. And what's the risk to the baby with placental passage of babesia or co-infections? That's unclear. How about dysautonomic issues, including POTS, and does that affect fetal development? How about the long-term child outcomes from in utero exposure? Like, what is the relationship of children with Lyme? We don't know if it's related to the mother being pregnant. And what's the best postpartum care for Lyme disease patients? This has to do with whether or not postpartum depression or a flare up of Lyme disease occurs after the pregnancy. So this and countless number of questions that come up in my work with women and men who have a baby. There are plenty of questions that are not resolved. Nevertheless, I have conversations like this with mothers and fathers facing uncertainty. Fortunately, the babies have been doing quite well, and the mothers and fathers are pleased. But there's still always the unknown. There's also, once the baby's born, there's always the unresolved issues about the future. I always advise mothers and fathers, if their child is sick, to be evaluated by their pediatrician or their primary care doctor. Thank you for joining me for this Lyme disease and pregnancy discussion. This is part of a Common Sense Lyme series. If you have any questions, thoughts, leave those in the comments section below. I read them, I respond to what I can, and have a good day.